Hi, good afternoon. Jill Allen here. I am so excited to be able to come to you again this afternoon and just give you some more pointers and tips on how we as an orthodontic community can make changes and make it through our COVID-19 crisis that we've got going on right now. And today I want to talk about pivot points and what can we do in our orthodontic offices to help us embrace the mindset of change and be able to look at what we've been doing traditionally and maybe make a pivot and say, okay, I can't do this, but maybe I can do this. And that's what I hope to help you with and bring you along with me today as we talk about this. So, one of the biggest questions that I've been getting a lot of asked to me by my doctors and my teams is, what do I do if I have to shut down my office? And, again, like we talked about yesterday, I still have doctors that are in all three tiers, some that have completely shut down, some that are staying open on a very staggered standpoint, and then others that have just decided that I'm going to stay open virtually, even though my office is closed physically. And so, I'm trying to help give good tips and information. I think daily we're continuing to see change in what is happening, and I think doctors are going to be making decisions day by day. So the big question that I'm getting right now is, if I cannot see patients in my office anymore, what is my option? I still want to be available. I still want to be there for patients. I still want to set myself up for success when we're ready to come back. But what do I do with this? And so I'm getting a lot of questions about virtual consults. So I want to jump in and talk a little bit about this. And the one thing that I want to tell you is, there's a lot of ways to do virtual consults out there, and there's a lot of tools to help us as doctors. So I'm only going to talk about one way, and this is how myself, Jill Allen, as an orthodontic consultant, is telling my doctors how to do things. There's a lot of great advice out there. There's a lot of great companies out there, but this is what I am advising with my patients and with my clients. I think number one, there are, in my opinion, four really great companies out there that are out there to help you succeed if you decide to tread and step lightly into the virtual concept realm. And these four companies are four that I've identified. I would love it if other people have other companies that they are using and you want to post it in the comments on this video. I would love that. I think everybody needs as much information as they can. And if there's other companies that I don't know about, I don't claim to know everything. But these are the top four that I have identified out there that I really think are easy to implement and easy to get your team moving with a lot of support. And so I think Rhinogram is a great company out there. They're a full service company that not only just helps with the virtual consult side, but also texting and emailing and some other really key components from helping patients process their payments to whatnot. Smile Snap is just an excellent. It's a newer company that's been coming on with a lot of traction out there right now, and I think that they are, again, just a great company to help us work on capturing how do we communicate with patients from that virtual consult to turning them into a start. Detma, their AVA program is wonderful. They have a really great virtual consult program out there. And then the last one that I just love is Startaloo. I think Startaloo has got a lot to offer, not only from the virtual TC aspect, but they do have a virtual consult component and then a whole follow-up piece as well. Each of these different companies, all four of these different companies I know right now, I've talked to almost all of the owners in these companies today. They're all offering, they are there to help you as an orthodontist and you as a team, as a treatment coordinator. They're offering great incentives and just, are here to support our orthodontic community. So if you feel like you need some type of a company to just, kind of help be that platform for you, these are four really great companies. Now, as most of you know, working with me, I have a lot of startups and I have a lot of my docs that are on tight budgets. And as much as we might want to use some of these existing companies, we just may not be able to. And so here's the really great news that I want to give you as doctors out there is we can still do this on a budget. And we just have to, again, it's that pivot, right? We have to think a little bit differently about how can I get in front of my patients. And I'm going to be talking about the flow of the exam in a minute, but I want to kind of talk to you about a few of the other items here. Something that was really great was yesterday, the health department announced that they were going to kind of relax their requirements on HIPAA required video. This is a great thing for all of us out there in, teledentistry and telemedicine right now. And this is kind of the area that we're moving into when we look at virtual consults. So what that means is it opens up all of these other platforms that are not dental specific. So I am coming to you, and I do a lot of when I work with doctors, I work on a platform called Zoom. It's a way to do a virtual meeting. I can share my screen. I can record a conversation. I can send the recorded conversation to my doctors, to my teams. It's just a wonderful platform out there. We've got GoToMeeting. We've got Skype. We've got FaceTime. We've got Facebook Messenger with video chat. These are all great external out of our community platforms that really do not cost a lot or very, very minimal at all. And I'm sure there are plenty of other really great companies out there that are going to help us achieve the concept of a virtual consult room on the internet. The other thing that I think is a real key, if we're going to use an external program, all of the 4 other programs that I just talked about have some type of a scheduler that helps you get a patient scheduled in to have a consult. I really like the company Calendly. Again, this is an external company out there, but Calendly actually links with Zoom, which is kind of the platform that I use with my clients. And what I think is great about this, if you're trying to do this on a tight budget, is you can schedule that virtual consult. Your patients, you can open up your schedule. They can literally just go on, pick a time to do a virtual consult, or pick a time to do a virtual follow-up existing patient exam. And then when that time comes, they get a reminder, you log on, they log on, and you've got a virtual consult or a virtual exam going. So really simple. It just takes a little bit of time to learn how to use these programs, but these are some great media tools out there if we're tighter on a budget and maybe we aren't going to work with a company within our industry for whatever reason. Again, highly recommend the 4 companies that I just talked about. I think they're all very reasonably priced, but I wanted to make sure that for my doctors, I was giving you all options or all the options that I know about to help you succeed in a virtual consult. So now let's talk a little bit about what do virtual consults mean? What does that look like to you, especially if you've never done a virtual consult before? And this is what I call our pivot point number 1. And the first thing that I want you to think about in a virtual consult is up until the consult happens, everything should stay about the same. So the number 1 thing that you need to be doing is getting really good information. If you've got a team member that's still working and taking phone calls, whether you're taking them online, through some type of an online form, or whether you're doing physical phone calls, which I hope you still are if your office is open and you're having somebody work, even if they're working remotely, is you want to be gathering good information. If you're using your phone slips, use your phone slips, gather good information. You're still able to verify insurance if at all possible. You can still have patients send you information. They can snap a picture of their insurance card. They can still fill out their health history form. They can email it to you remotely. We just have to pivot and think, okay, how can I do this differently if I can't do this in person? The next thing I want you to think about is you can call a dentist. All the dental offices are still open. They may be reduced staff, but you may not be able to take an X-ray for your exam, but we should be able to get, if a patient has a previous dentist, we should still be able to get a current panoramic X-ray or a full mouth series on a patient. So let's go ahead and have those sent over to our office. And then the next thing I want you to do is set a time for a virtual exam, whether you're letting a patient schedule on their own, go onto the scheduler and pick a time, or you're helping them schedule it. And you can just do virtual exam consults scheduled out within your existing schedule. You just have to make some notes that you know it's going to be a virtual exam. Ideally, if you can, if we're working with these other 4 companies that I was talking about, my ideal would be is that we have the patient send you some information ahead of time. So can they send you some pictures ahead of time? Can they get you their concerns ahead of time? That would be ideal. If they can, we're going to use those virtual assistant programs. Maybe it's just using some good old-fashioned spoons to help give you some side bites. You let the patient know what you're looking for. Let them send that to you. And then, if they just need to, during the visit, while you're on virtually, maybe they just need to get a little close to their screen and show you their bites using their hands, pulling their cheeks back. The thing of it is, our goal is not to have the most diagnostic exam. We're just trying to have a good exam and to move forward. So our pivot point number 2 is when we are getting ready for this exam, just like we would get ready for our consult, you have to be thinking ahead saying, how do I make my virtual office, whether I'm in my office or I'm doing a virtual office from my house, how do I be ready for that? So the first thing you need to do, you need to check your video on your computer. Do you have a computer that has a camera on it? Do you need to go out and buy a camera for your computer? Do you have audio that works? I suggest anytime I do, videos, I use earbuds. Some people use big headphones. I don't think you need that. We just need something that's going to last a maximum of an hour. Earbuds are great for that. They last an hour. You can get through. They have good audio sound, and I don't think they're intrusive to the video. Another thing that I think is important is you need to look around. When I look and I get ready to do a video, I'm looking around to say, what can patients see behind me? What can my doctors, my team members see behind me? Maybe I've got dogs in the background that I need to shut a door on. Maybe I need to put a sign on my door that I'm in a meeting. Whatever it is, but you want to just make sure that your surroundings are not distracting to your potential new patients. And of course, you want to look professional. Just because you're at home or just because you're in a more lax environment doesn't mean that you aren't going to make a first impression. So keep all of that in mind. TCs, if you're going to be helping your doctors with this, have your makeup on, have your hair done, be ready to go. It's still a consult. It's just a screen consult versus a face-to-face consult. The next pivot point is building a really good relationship with the patient. So you're in front of them, you're on the screen. This is your time. You can still do a meet and greet. The goal is to make a friend, build a relationship. You are meeting their needs where they're at. They're stuck at home. They may not be able to come into your office. So we're meeting their needs. And you're also meeting your own needs and being able to still see new patients, still get to know people, and still be able to provide a service that they're looking for. Make sure that you're asking about their concerns, making sure that you're taking an opportunity to look at their teeth, especially if no pictures were provided. Again, this doesn't have to be perfect. This doesn't have to be what we do when we're in our office, but it will be good enough. And if you come at this with a good attitude, you're going to do just fine. And the last thing I just want you to make sure and do is explain that you're doing a visual exam and you're going to follow up with them at their next appointment with a diagnostic exam and an X-ray appointment, so that if there's anything that they're concerned about or you've missed because you can only see them from a physical visual standpoint, they don't have to worry. Because you're going to still make sure you're not skipping any steps. We're just skipping the step of taking the X-rays ahead of time or during the exam versus doing it for their next appointment when they come in. Our next pivot point is I want you to just make sure that when you have finished talking to them about their treatment, and docs, I really, for lots and lots of years, I've been doing this 28 years now. There was a time where, a lot of docs didn't even take X-rays.
Now, I'm not saying that that's necessarily right or wrong. All that I'm saying is there have been many years where we weren't using X-rays as part of our exam, and now that we can, I think it's a wonderful. It's absolutely what we should be doing in the standard of care. But right now, for this virtual consult, we can still be giving a good visual exam to a patient. So when we think about, all right, we can't look at X-rays, but we can still talk about treatment. The beautiful thing is all of you are really good doctors. You've been doing this. You've got this. So give the patients what they want to hear. Give them good information so that they can get a start. So what does that look like? We want to make sure that we want the patients to know, do you think they're going to need treatment? Super simple. We can determine that from the way a patient is biting, the way they're looking at us, what we're asking them to do. We can look at their profile. We can look at this or that. We may not be able to tell them if they need teeth out or, exactly what that treatment plan is going to be, but we can tell them if they need treatment or not. We can also let them know, on a good estimate, how long do we think treatment is going to be? We in most of my offices, we either have got levels of treatment or months in treatment. So, maybe they are a full case level 4, or maybe you think they're going to be a full case 18 to 24 months. Again, the goal is to get the information in front of the patient so that they can make a decision and hopefully get a start on your books. Another thing is, when can we get started? Well, if your office is closed, we can't get started right away. But maybe you've decided that May is going to be your month. And as of right now, as long as everything stays as is, maybe you're picking, May, or maybe you're picking the end of April, whatever it is, at least if they're ready to go, you can tell them that, and you can help them and encourage them to go ahead and get that start on the books. And then finally, how much is it going to cost? And this is something, as doctors, if you aren't comfortable presenting fees, which, in most cases, I don't suggest that doctors present fees. This is something where you can say, hey, I'm going to have my treatment coordinator step in and go over this with you. Or I am going to, when we're done with this call, I'm going to have my treatment coordinator follow up with you and send you out the fees. One of the things that I think is also important is, once we've hit those points, do I think they're going to need treatment? How long is it going to take? When should we get started? How much is it going to cost? These are basic things. This is what everybody wants to know when they come into an exam. The part about the X-rays and, all of that, when we are talking to them about what's going to happen at that next appointment, we just have to switch what we're doing. And we have to say, hey, when you come in for that next appointment that we're scheduling for, the first thing we're going to do is we're going to do an updated set of X-rays. And I'm going to review those and have a mini meeting with you and let you know if there's anything that I'm concerned about, let you know if there's anything that I've seen on the X-ray that would change our treatment plan. And then we will move you into our clinic and we will get you set up for the scan, or we'll go ahead and get those braces on, or whatever treatment plan it's going to be in moving them along. So remember, docs, you still have the opportunity to do your full exam. We're just doing it a little out of order. We're pivoting and helping get our patients the information that they need, so hopefully they can schedule a start with us. So our next pivot point number 5, what do we do with our follow-ups? So again, I was just saying, a lot of times my doctors aren't comfortable or should not be the ones presenting fees. So if we have a TC that can step in, if you guys are using your slider programs off of your operating systems or any of your external systems, I think that's great. If you're one of my clients, and we are using the Excel sheet, we can be saving those as PDFs and sending those on to patients. If you're a practice that just still does handwritten sheets, you can still fill it out very nicely. You can save it as a PDF and you can email it off to the patient. We can still keep this virtual. But what the important things that you want to do is you want to make sure that we get our fee sheet emailed out to the patient. We want to send an appointment reminder because hopefully we have scheduled that patient into the next month for openings for starts. And a tip that I want to talk a little bit about is I have some of my docs that are doing virtual consults right now, and they are offering a discount to pre-schedule that visit. And they have patients that are taking them up on it, which I think is a great idea. You know, a little $100 discount for reserving their appointment ahead of time, or maybe a discount for going ahead and doing their down payment now and reserving their appointment ahead of time. So again, think about how we can keep cash flow coming in, make it good for the patients, make it good for yourself and your schedule. We can email out a welcome letter. We can still send out all of that great collateral information. We can still correspond with our dentist. And if you work with me, you know that I say that corresponding our dental letters are marketing letters. So we should be putting that out there. We can then direct them to our social media pages, and you can be, you know, continuing to talk about your practice. They can get to know you. We can be setting up email and text correspondence for them. And if they're ready to make a payment, we can either be taking a payment online or setting up some type of a payment link for them to, you know, get going. And a lot of times with a lot of these external companies and with our operating systems, they may be able to sign their contract virtually. You may be able to get all of this information done ahead of time so that when the patient is ready to come in and get started, you're ready to go. It's just a matter of signing a consent, doing updated records, doing a little mini consult with them to talk about exact treatment plans, and then getting them going and getting them ready for their scans or getting them ready for their bondings. Finally, number 6, I really want you guys to think about going ahead and working with your active patients in a virtual realm. So what can we do to help our our existing patients? We can still do virtual follow-up active patients. So maybe we've generally been seeing our patients on a 6 to 8 week interval, and now we're deciding that, you know, I think we're going to move to a 12 or a 16 week interval, but we still want to do a check-in at 8 months. Why not go ahead and schedule a virtual check with your patient? You can schedule them. You can do a one-on-one meeting just like I'm doing here, talking to the screen. You can look at how their elastics are going. You can look at their oral hygiene. You can make a determination for any reason if they need to come in for an emergent appointment. But the beauty of this is it gives value to the parent. It gives peace of mind to the parent and to the patient that they're still being monitored even if they aren't in your office on their normal rotation. So again, it's that normalcy that we can bring to them in these exams. Another thing that I would suggest is now's a perfect time for you guys to be making some videos that you can send out, maybe oral hygiene videos if you notice somebody's got an issue, or maybe you can use your typodonts to show them how to put elastics on, and then you can send the elastics out in the mail. There's just so many tools out there. Maybe you've got some videos in some of your softwares that you can load up onto your YouTube page and say, hey, I want you to watch this video on how to turn your expander or how to brush your teeth or do this or that. You know, now is the time to think virtually about how can we make this a better experience for our patients and not make them feel like, gosh, you know, I saw them 1 month and now I won't see them for another 12 weeks or something. So let's utilize virtual appointments with our active patients, not just with our consults, but with our active patients as well. Now, for my docs that are still seeing patients out there, one of the things that I want to go over is I know that maybe you're not ready to move into that virtual realm because you just don't need to yet. What I want you to think about is how can you position yourself to to be able to still have patients come into your office. And I really like this phrasing, VIP appointments. And, and I think you should just be thinking about, how can I get patients into my practice? How can I give them a VIP experience? So maybe that means that your normal new patient exam is scheduled for an hour and a half so that the patient doesn't have to encounter any other patients when they're coming into your practice. Or maybe when you are setting them up to come in for their new patient exam, you're telling them right from the beginning, if you're ready for treatment, we're going to have our clinic set aside where nobody else is going to be in there to go ahead and get your bonding done this day or your aligner treatment done this day. I think that going ahead and helping do your part to work with social distancing, we can still do that and still be open. So maybe you're closing your waiting rooms. Maybe you're asking patients, telling them that they aren't going to be scheduling in your office. You're going to want them in and out of your office. So it's your team's job to call them to help set up their future appointments. Maybe your patients are texting or phoning in when they arrive, and then you guys are letting them know when it's good for them to come into the office. So again, you're just kind of helping with that social distancing. And for my bigger practices, my ones that are busier, maybe you are just relieving your schedule a little bit. Now's the time to think outside of the box. Do we still have to work an 8 to 5 schedule if everybody is off? Maybe your teams, like we talked about on yesterday's presentation, want to do some staggered hours. So maybe you're going to do some staggered hours, and maybe we're able to distance our patients. Maybe we're going to only see patients every other chair, or we're only going to do 2 in a clinic at a time and 1 in a consult room and nobody in the waiting room. Like, take the time to think outside of the box and think, how can I change the way I have been doing this to work with what's happening right now as I continue to stay open as long as I can. And I think that it's also really important for you to plan for the future. And I think there could come a time where you aren't going to be able to see patients anymore in your office for at least a small period of time. And so now's the time to really think about, can I maybe do some virtual and some in-office visits? Maybe, I do that virtual check at 8 weeks, and then I see a patient in the office. So, it's hard to know where times are going and what's happening. But for my docs that are still open and still seeing patients, I just highly suggest that we work and think about, how do I provide VIP experiences for my patients? How do I help with social distancing? How do I help them feel good and my team feel good? And then the last thing that I want to talk about is just socializing. And this is what we're really going to jump into on Friday. But I think it's super important that you guys focus and take this time to make sure your patients know you're open. Even if you're closed physically, you're still open virtually, hopefully. So blow up your social sites, keep your patients informed, and try and keep it business as usual for as long as you possibly can. So get out there, talk it up, blow it up. You got this. And then tomorrow, here's what we're going to be talking about: taking advantage of the pause. So for everybody that's physically closed but still open, what are you going to do with your teams? I'm getting calls about this all the time. Jill, what should I be doing? I'm going to come to you with a bunch of helpful tips and hints on what your team can be doing, what you can be doing as a doctor, what your team can be doing to stay engaged and to stay busy, whether they're working remotely, or they're working in the office, or we're looking for something to do once they come back in. So again, Jill Allen here from Jill Allen and Associates. We are here to help. We are here to do training for your teams. If you'd like to give us a call, reach out to us on our website. We are here for you, even if it's just to be support for you. Have a great evening.